Hey guys, my name is Leah Buckles. I am the founder and CEO of Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. Today, I want to come on and do a video about IBS or irritable bowel syndrome and the rating criteria and how to meet the criteria for 30%, which is currently the highest rating criteria for that condition. Okay, so please keep in mind that these ratings are always subject to change. You should follow up with your accredited legal representative, like a VSO, accredited claims agent, or attorney if you have questions about this. Okay, so for irritable bowel syndrome, let's start off by talking about what is irritable bowel syndrome. So it is a functional, not a structural, functional gastrointestinal disorder that doesn't really meet criteria. So it's essentially oftentimes a diagnosis of exclusion, meaning your doctor has looked at other conditions, maybe done a workup, done stool studies, maybe they've done some imaging. They don't necessarily have to do imaging or different types of laboratory testing, but they've determined after ruling out other conditions that this is what you have. Okay. There's a criteria. I don't want to bog this conversation down with it, but there's a criteria called the Rome criteria, which is often used in medicine to determine if you meet, these specific check blocks. Hey, then you might have IBS. So that might be something you want to talk to your doctor about. Remember, this is never medical or legal advice. I'm just going over some factual information for you guys to maybe take a look at or discuss with your own treating providers, right? So there are, generally speaking, three different types of IBS. We have IBS-C, which is the constipation type. We have IBS-D, which is the diarrhea type. And then there's IBS-M, which is mixed, where you can kind of have both. Okay. And so a person can be suffering from either or from both, as I mentioned. So generally speaking, this is going to be something that's going to have lasted for more than just a few weeks, right? That Rome criteria goes into a little bit more. And there are certain symptoms that you may or may not have in conjunction with that, right? So if you've received a diagnosis of IBS and you think it's related to your service, there are a few different ways that it can be related to your service, either on a primary or direct basis or a secondary basis, right? So on a primary basis, we talk about someone that's been diagnosed with IBS in service, or they exhibited those symptoms, or maybe they have a presumptive, they were in an area. For example, IBS is often considered one of those functional gastrointestinal disorders that are known to have developed in Gulf War veterans, right? Gulf War from 91 to present veterans. So that's definitely one of those things VA.gov goes over Gulf War veterans and some of those functional disorders, functional gastrointestinal disorders. And then on a secondary basis, it can be related to things like mental health conditions, right? Or perhaps, you really need to show how one condition that your service connected for has either caused or aggravated your condition, right? I think I have a few other videos you may want to check out specifically, like IBS secondary to PTSD, for example. So that may be helpful. So let's get into that rating criteria. Okay. So right now, this is rated at either 0%, 10%, or 30%. So if somebody has a 0% rating, that essentially means that they don't have very many symptoms. Okay. I have a couple notes I'm going to read off to you. So they have mild symptoms of IBS, such as disturbances of bowel function with occasional episodes of abdominal distress. At the 10% rating, they exhibit moderate symptoms of IBS, such as frequent episodes of bowel disturbances with abdominal distress. Some of those examples of bowel disturbances include diarrhea, episodes of diarrhea, severe gas, and bloating. And then the 30% rating, which we talked about being the current highest rating, is if you have severe symptoms like diarrhea, alternating diarrhea and constipation, constant, more or less constant abdominal pain. That's a big part of it. And that's pretty much it. So most of these things are on the DBQ, the Disability Benefit Questionnaire. I have a really great video on what to expect at a CMP exam for IBS, and that might be something that you guys would want to check out to kind of get a better understanding of how those things are checked off and looked at, right? So I hope this was helpful so that you guys could get a better understanding of what those ratings are and what that 30% criteria, that more or less constant abdominal distress and that alternating diarrhea constipation is kind of part of it. So Thanks for watching, and please let me know if you guys have any questions or if there are any other videos that you guys might be interested in watching. I'm always looking for new content, and have a great day, guys.